Donate your plasma was a common refrain at one point, in fact, until very, very recently when it came to COVID treatment in India. Now, suddenly it seems that plasma therapy is no longer recognized as a part of COVID treatment. What has brought about this change? Why has this happened? And all this while, did the plasma donation make no difference at all? Avantika Ghosh, who tracks our COVID coverage, is with us in this episode of Government Matters to help us find answers. Avantika, thank you so much for joining us today. Avantika, just to understand, what is this sudden decision to not allow plasma therapy or to not have plasma therapy as an acceptable part of COVID treatment in India? Avantika? Hi, Avantika, can you hear me?
Yes.
Yes. Sorry. So I think we lost you for a moment there. We were just, I was just telling our viewers how at one point donate your plasma was the most common refrain in India. And now suddenly plasma therapy has been discontinued as a part of COVID treatment. So what is this latest decision? What does this mean?
Okay, so what has happened is last night there was a revision in the clinical management guidelines of the ICMR. So plasma was always an investigational therapy, much like remdesivir. So it was not a proven therapy, but something that has worked in other diseases. This concept that you can actually transfer antibodies against a particular disease from a person who has recovered from it to another one who is still suffering, and then you can kickstart that the second person's immune system. This is the basic concept. It's called passive immunity. So you basically use a passive method to kickstart the immune response in a person, and this is like 100 years old. I mean, really old physiology textbooks talk about this. This is, as a concept, it's really old. Just that in this particular disease, there have been studies after studies. There is ICMR's own PLACID trial, which showed otherwise. Then the latest one is actually the recovery trial from the University of Oxford, all of which have come to the same conclusion, that plasma therapy does not in any significant way improve outcomes. But I think there is a bit of, I was just having this conversation with somebody before this program. There is a bit of a gray area there, in the sense that because it is such a well recognized physiological concept. So this person that I was talking to, he's a microbiologist. He was formerly with AIIMS. He's retired now. He was actually telling me that this is like throwing the baby with the bathwater, because we don't know, we haven't tried it enough. Maybe where we really went wrong is that we let private hospitals charge, and we created, governments opened plasma banks. Delhi government did, Maharashtra did. So we went overboard with the concept and we sold it as a
treatment.
Pure.
Right.
Whereas his point is, we haven't examined it enough scientifically to actually completely junk it. It's not fair to use it as a treatment. It's certainly not advised in a person who is very serious. And that, I think, is where we went really wrong. It's when a person started really deteriorating that we gave plasma, whereas plasma actually works in the first 72 hours.
Okay. So Avantika, to try and understand, as you rightly mentioned, it became like this big thing sold as this cure for severe COVID patients. We heard so many ads from the government, including the Delhi government, saying donate your plasma if you've just, if you've recovered from COVID in this duration, etc., etc. In that sense, do you think there was perhaps some harm that was caused to not just COVID patients, but to the entire idea of how we should approach COVID treatment in the country?
I think yes. See, science which is half informed or sort of not practiced to the T to what it requires. For example, one very common thing that happened was, young people would go and donate plasma as a thing of social service. But the problem is, young people, as a rule, usually had mild infections, and it is possible that if you have a mild infection, the antibody titer in your plasma is not going to be very high. So that plasma, anyway, unless you actually check for there are various kinds of antibodies, but there are only a certain kind, what are called neutralizing antibodies, which will actually help treat the disease. And so in the initial days, especially, we were giving plasma just, this person recovered, this person is negative, so just take out plasma from. We had no idea if that person had the requisite antibodies. That's number one. Number two is, when are we giving it? Even around us, even now, when you see, it's when a person is going bad. So when a person is going bad, it is possible that he or she has gone into what is known as the cytokine storm of a hyperactive immune response, sort of, creating havoc in the body. What happens when you try to further kickstart that immune response? That's a completely counterproductive exercise, right? That doesn't mean that as a proof of, as a concept, it is invalid. But I think it's a very good thing that we have finally brought it out of this clinical management guidelines, because way too much time, money, energy, emotional energy has been spent on plasma, which was disproportionate to the evidence we have, to what it did to patients,
to its benefits.
Yeah, completely, to its benefits. And also, I was just going through some of my old stories. Look at the number of people who've had it, who've taken it. Delhi Health Minister Satyendra Jain. So it's just that somehow the way this therapy was being sort of marketed, for want of a better word, was completely disproportionate to what it was doing to patients.
Right.
But let me again reiterate, that does not in any way discount the science. It's just we need to understand it better.
Right. Okay. So let's take this first question from Gurbani. How does plasma therapy really work?
Okay. So I think I answered that a bit, but let's see. Say I have the disease and I recover from it. The assumption is I recover because my body has produced antibodies, and that is why I have recovered, which is in the first place an incorrect assumption, because I may have recovered also because my T cells fought it well. There are zillions of other things than antibodies, right? So anyway, let's just sort of explain the concept. So the assumption is I have antibodies, and if I give that, if my plasma is basically the sort of the fluid, let's say, in which blood cells float. So if you remove blood cells from the blood, what remains is the plasma. The plasma also has these other things called antibodies. It has many other things, but antibodies are present in the plasma. So the assumption is that I fought off the disease because I have antibodies. And now if this same plasma enters the body of another person who has the disease, that person's body can be taught to produce its own antibodies, because let's say an antibody is it's like a prototype. Right. So you have shown your body, if you have shown the other patient's body the antibody prototype that needs to be made to counter this disease, and so then the body's own immunity takes over and you start sort of fighting it yourself. That's the concept.
All right. Okay. Sridatta Satuluri, is the plasma therapy ineffective with the newer variants or with the original virus strain itself?
I don't think we have enough data on that. And given the timeline of these, some of these, though recovery happened in the US and UK strain was already there in the US from July. So these studies don't actually talk about strains. They simply say that it has, in COVID-19, there's no difference of outcome. And let's just face it, when Placid trial happened, there was no other strain. It was just the old original strain. And even then, so PLACID trial is ICMR trial. It's the world's largest plasma therapy trial. Even that reached the same conclusion. So to say that plasma therapy works against the original, not against this variant, I don't think is true. And that again, I think comes from that initial overselling of plasma therapy as a wonder treatment. We have to really get out of it. And for our purposes, for practical purposes, we should just go with this straight thing that plasma therapy does not work.
Okay, I'll take these two related questions. One is from Sakshi on whether there are any side effects to taking plasma therapy, and the other is from Aryan, who says, what about those who've already taken plasma therapy?
Those who've already taken plasma therapy and they have recovered, it's okay.
Right. I think the question is whether there are any side effects, or there can be any side effects on the longer run.
I think that's one of the things that really worked. And that's, see, we first, Dr. Balram Bhargav first talked about removing plasma therapy from the National Clinical Management Guidelines as far back as October. There were differences of opinion, and some of the things that I'm saying now is what delayed this decision for 7 months. But one of the reasons also why this delay happened, it was allowed to happen, is the fact that it does not do you harm. It's plasma from one person that's matched, and it's infused into another person. So it doesn't necessarily cause you any harm. And as I think I've said many times before in your show, that the first principle of medicine is do no harm. And plasma survived all of these adverse studies simply because it did no harm.
Right. Okay. So now we have a bunch of questions about the new DRDO developed medicine. There is one from Krishna Mahatre. There is one from a handle called Amit Shah, not the Home Minister, I'm assuming. There is one from Ajib Bashir, all wanting to know about this new medicine, whether it's going to be effective, whether it's going to lead to any significant change.
I know very little about medicine, so I don't think all I know is that this is a very old drug. It's been around for a long time. This is basically being repurposed for COVID. I have not looked at the data. I have not looked at anything. So I don't think I should be taking those questions.
All right. So Avantika, we'll bring you back to talk about it later when there is more evidence available about this medicine and its impact on COVID treatment. Okay. Vishwa Mandal wants to know, could you let us know about the connection between smoking and COVID?
So this is a very tricky one. And, in the initial days, there was this theory that the virus actually competes with the same receptor as nicotine. So a person who smokes is less at risk. And this was, some very fairly respected journals who peddle this theory. But since then, we have understood one thing, okay? Whether the virus fights with the same receptor or not, or any of that, let's just say your key to recovering from COVID is your lung health. And there is no dispute that in a smoker, lung health is far worse than in a non-smoker. I mean, let's not get into what Delhi's pollution does to our lungs.
Right.
But overall, even with this pollution, a smoker's lung would look far, far worse. And I've been actually seeing some of the CTs of COVID-affected patients. So, I mean, there is absolutely no doubt that if your lung is already damaged, then COVID will do you way more damage. Your chances of getting out of it without going into oxygen over a long period of time post-recovery or any of that, or lingering weakness and all of that, cough, weakness, whatever, are far better if you're not a smoker.
All right. Okay. Never a good excuse to smoke in any case. Coming back to plasma, this question from Kajal Kumari. So how should we go about it? Because many NGOs are now working for plasma donations. Should they change the direction of their work? So it's a bit problematic, because what about all this plasma that's been collected and the plasma banks that, as Kajal is pointing out, a lot of NGOs have also started?
So I think they should just stop. Plasma belongs nowhere except in a laboratory, in a clinical trial, in a properly prescribed clinical trial which has registered with, which has clearance of the ethics committee and all of that, plasma belongs nowhere else. And which is why I mentioned the government and all of these FM channels that advertise plasma donation. All of that really needs to stop, because we have been peddling this for way too long without adequate evidence. Let's just get the science right first, and then we'll make it a treatment. Right now, it's way too premature.
Okay. This is a question from Rohit Verma. I gave plasma 5 times. Will there be any side effects? So I think now there is also worry about those who actually did the task of going and donating plasma.
No, I don't think there will be any side effects. It's just like donating blood. Your body will make it back. It's a normal, you're a healthy person, young person, your body will just make it all back. So I don't think there is any particular side effect of donating plasma 5 times, 10 times. No, that's not.
Okay, Shashwat Srivastav, does that mean that monoclonal antibody treatment also doesn't work?
Yeah, so that's one of the arguments in favor of plasma, that if monoclonal antibody worked in President Trump, why doesn't plasma work? So here's the thing, there were many other things that President Trump got. And monoclonal antibodies, again, is an open question that has to prove itself in the long run, and sort of, just one Trump, and we don't know what cured him. Honestly, that's the actual. See, I was thinking when I was talking to this person that if plasma has to be given in the first 72 hours, in the first 72 hours, mostly you don't feel unwell at all. Nobody feels you're unwell. That's like an almost impractical window to give plasma, right? Why would you give plasma in the first 72 hours unless in a clinical trial?
And then you would have to give it everywhere to everybody.
No, unless, so that's what I'm saying. So this can only, these sorts of parameters can only be set in a clinical trial when you're doing it for that. Normally, treatment decisions are not made to prove a science. Treatment decisions are made to make patients better.
Right.
Yeah, go on, please.
Okay, sorry, Shrija had a question on the vaccination gap of Covishield being increased between 2 doses. I think we all had a detailed Government Matters on it the day this decision, or the day this was proposed. So you can go back to our YouTube channel and watch that. Avantika, before you go, I will ask you for the latest update on India's COVID figures. What's it looking like? Give us some good news, please.
Yeah, so yeah, I have good news. So
finally.
It's actually been coming down. Yesterday was 2.81 lakh. Today it's 2.65, I think. The death numbers are still high, but that also, remember, because so there's a 15-day lag, right? So your cases, the cases that are now coming in, or let's say the deaths that you're now seeing, are outcomes of cases that maybe came in 15 days, 20 days ago. So these are basically the deaths we are seeing from the time we hit 4.14 lakh, which was our highest so far. So to that extent, numbers are coming down. But let's not forget that 2.65 lakh is also a
huge number.
Extremely, just from perspective, in the last wave, our highest daily cases was 97,000 something. So this is still like 3 times almost.
Right.
Than 3 times.
Almost 3 times, right.
Yeah, and now we are getting reports from across this country of states again running out of health infrastructure. People, I mean, what Delhi went through basically. Delhi looks really good right now. Positivity rate is it's below 10. Beds are opening up. Though this morning I was talking to a friend, and he's a doctor, and he was telling me that don't think it's that easy also, because there is still a waiting list in our hospital for COVID patients. But things are easing up. Delhi, if you would remember a while back, Delhi actually offered to send out its quota of oxygen to states which are more in need. So, I mean, at least we can afford to be generous. We are out of those very, very desperate times. But yeah, I mean, we still, all of us are still living with a lot of bad news around us.
Right.
So again, same thing. Masks.
Right. Always, I mean,
There are no vaccines. Its vaccinations are down to 15 lakh. Yesterday, there was just 15 lakh odd vaccinations. If you get the vaccine, great, take it. But put your mask on. Please practice hand hygiene. Please do everything that you were doing till now to keep the disease away.
Right, absolutely. There may be a sliver of hope, but there is no scope for any kind of complacency. So, as Avantika said, all the COVID protocols must be followed to the T. Thank you so much for watching Government Matters and for sending in your questions. At 4 p.m., we have another live with economist and ThePrint's contributing editor, Ila Patnaik, in conversation with